Are there medications to manage bladder conditions effectively? Let's dive into the question of whether there are medications available to effectively manage bladder conditions. The answer is yes. There are several options for treating various bladder issues, including infections and bladder cancer. These treatments are based on established medical guidelines and have received approval from regulatory authorities like the Food and Drug Administration. First, urinary tract infections are common bladder-related issues that often requiring antibiotics for treatment. The choice of antibiotic can depend on the type of infection and the patient's specific characteristics. For uncomplicated urinary tract infections, especially in women, oral antibiotics like gepotidacin, which is marketed as Blujepa, are effective. This antibiotic was recently approved in 2025. Treatment can last from a single dose to about 5 to 7 days. In more complicated cases, such as those involving men or kidney infections, other antibiotics like fluoroquinolones may be necessary. Sometimes, these cases requiring hospitalization and longer treatment durations. However, it is important to note that antibiotic resistance is becoming a significant concern, complicating treatment options. Next, for bladder cancer, intravesical chemotherapy is a common treatment approach, especially for low-grade and intermediate-risk cases. Mitomycin is one such medication that is delivered directly into the bladder. It has been approved for this purpose by the Food and Drug Administration. Recent advancements include a sustained-release hydrogel formulation known as RTGel technology. This innovation prolongs the drug's exposure to bladder tissue, potentially enhancing its effectiveness. It also allows for home-based administration, making it more convenient for patients who may have mobility issues or live in remote areas. Additionally, while not strictly bladder-specific, certain kidney diseases can affect bladder function. For example, conditions like C3 glomerulopathy and primary immune complex membranoproliferative glomerulonephritis now have targeted treatments available. One such medication is pegcetacoplan, which helps reduce proteinuria and addresses immune system dysfunction, indirectly benefiting urinary health. In summary, antibiotics are crucial for managing bladder infections, with new options like gepotidacin helping combat antibiotic resistance. Intravesical chemotherapy with agents like mitomycin is effective for certain bladder cancers, with innovations improving patient convenience. Emerging targeted therapies for related kidney diseases may also support bladder health indirectly. It is essential to remember that all treatments should be personalized and guided by healthcare professionals. They will consider the specific bladder condition, the patient's health status, and the potential risks and benefits. Always seek professional medical advice for diagnosis and treatment rather than relying on unapproved or alternative therapies.